are we located right now?
Roanoke, Virginia, RUC campus.
Okay, great. And who is our president?
Joe Biden.
Perfect. And what is today's date?
Does it?
That's
11/30/2021.
Okay, great. Patient is alert and oriented ×3. On a scale from 0 to 10, with 0 being no pain and 10 being the worst pain you've ever felt, how would you rate your pain today?
0.
Okay, great. Patient verbalizes that there is no pain today. So I'm going to go ahead and start our examination. We're going to work from the head down to the toes. If at any point you feel uncomfortable or experience any pain, let me know and we can stop or take a break. So I'm going to go ahead and start by inspecting your head. So head is normocephalic, even distribution of hair, no alopecia is noted, no lesions noted either. I'm going to go ahead and palpate it. Okay, no masses felt. I'm going to go ahead and take a look at your face. Facial features are symmetrical. Skin color is consistent with ethnicity. Can you raise your eyebrows for me? Good. Can you smile? Good. Frown. And puff out those cheeks. Good. Cranial nerve 7. Facial nerve is intact. I'm going to go ahead and palpate your skin with the dorsum of my hand. Okay, good. Skin is warm and dry to the touch. I'm going to go ahead and inspect your eyes. If you wouldn't mind removing your glasses for me, I'm going to go ahead and put on gloves. While I'm doing that, I'll note that the eyebrows and eyelashes have normal distribution of hair. Eyelashes have normal curvature. Eyelids are symmetrical. Sorry for the squeaking. Eyelids are symmetrical with no drooping present. I'm going to go ahead and look in your eyes. The sclera is white with slight vasculature noted. I'm going to go ahead and pull down on your eyelids. Good. The conjunctiva is translucent with pink showing underneath it. I'm going to go ahead and shine a light just across your eyes, so check out that cornea. All right, corneas are clear and smooth with no abrasions noted. I'm going to go ahead and do a few tests on your eyes, so if you can just keep looking forward, I'm going to shine a light into them. Good, and the other one. Good. Okay, if you can focus on the screen at the front, and now my pen. Good. Pupils are equal, round, reactive to light and accommodation. I'm going to go ahead and inspect your ears now. Ears are symmetrical, even placement on the head. No signs of redness. No drainage or foreign objects noted either. I'm going to go ahead and palpate the ears. I'm going to start at the pinna, the tragus, and the mastoid process. Was there any tenderness noted? Okay, good. No tenderness noted with the ears. Would you mind taking your mask off for me, please?
Sure.
Thank you so much. I'm going to inspect the nose. Nose is roughly symmetric. The left nares is slightly higher than the right. I'm going to just shine my light up here. I don't see any drainage, redness, or foreign objects. Septum is not deviated either. I'm going to go ahead and move on to your mouth now. Lips are pink and moist, consistent with ethnicity. No cyanosis or cracking noted. If you wouldn't mind opening your mouth for me. Thank you. Tongue is pink with even distribution of taste buds. The hard palate is white with normal rugae. Soft palate is pink and smooth. The buccal mucosas are pink and smooth and moist with no signs of chewing or lesions. Teeth are all present, white and straight with no obvious decay or dental caries. Can I see your gums, please? Okay, good, thank you. Gums are pink and moist with no swelling or bleeding noted. Could you lift your tongue up for me? Good, frenulum is intact with no nodules or ulcerations noted. All right, can you take a break? I'm gonna look in the back of your mouth. I'm gonna check out those tonsils. Okay, tonsils are equal bilateral with no pockets of pus. They are a +1. Could you go ahead and say ah for me, please? Good. Uvula rises midline. Cranial nerve 9, glossopharyngeal, and cranial nerve 10, vagus are intact. Can you stick out your tongue for me, please? Good. Tongue protrudes midline with no deviation. Cranial nerve 12, hypoglossal nerve is intact. Okay. I'm gonna go ahead and you can put that back on. Thank you. I'm gonna go ahead and move on to your neck. I'm just gonna kneel down for the rest of this, I think. The skin on the neck is The color is consistent with ethnicity. I don't see any goiter or pulsations noted. I'm gonna go ahead and palpate. Skin is warm and dry to the touch. Trachea is midline. I'm gonna go ahead and palpate your carotid pulses one at a time. Good, carotid pulses are equal bilateral, +2 with no thrill observed. I'm gonna go ahead and move on to your thorax. I'm sorry.
It's okay.
I'm going to observe. Patient does not display any signs of labored breathing or accessory muscles used. The skin is free of lesions or obvious masses. I'm gonna go ahead and palpate now. Skin is warm and dry to the touch. I'm gonna go ahead and just pinch your skin underneath your clavicle. Good, no tenting is noted. I'm gonna go ahead and listen to your breath sounds. I'm gonna listen on your back first. I'm gonna listen with the diaphragm on my stethoscope, and every time I move my stethoscope, if you could take a deep breath in and out for me, please. And if at any point you feel lightheaded or dizzy, let me know and we'll take a break.
Sounds good.
All right, I'm gonna palpate for your scapula so I don't listen on top of that. Good, lungs are clear and equal bilateral with no adventitious breath sounds, crackles, or wheezes. Are you still feeling okay? All right, I'm gonna go ahead and listen to a few spots on the front. I'm gonna listen to those lungs again. Again, every time I move my stethoscope, if you can just take a deep breath in and out. And again, if you feel dizzy or lightheaded, let me know and we'll take a break. Good, lungs are equal bilateral with no adventitious breath sounds, crackles, or wheezes noted. And I also want to note that normally I would be listening underneath clothes. I'm gonna go ahead and move on to assessing your heart. I'm gonna go ahead and palpate your apical pulse, which is located at the 5th intercostal space, midclavicular line on the left. Okay, gentle tap is noted with no thrill observed. I'm gonna go ahead and listen to that apical pulse. Again, 5th intercostal space, midfollicular line on the left. I'm gonna listen with the diaphragm on my stethoscope, and I'm gonna listen for a full minute. After listening for a full minute, the apical pulse is 65 beats per minute with a normal rate and rhythm. I'm gonna go ahead and listen to 5 different places along your chest for your heart sounds. I'm gonna listen with both the bell and diaphragm on my stethoscope. If I spend time in one spot longer than another, don't be panicked. I'm just trying to get a good picture of that heart. I'm gonna start with the diaphragm. I'm gonna go ahead and listen at the aortic, pulmonic, the herbs point, the tricuspid, and the mitral. Good. S2 and S1 and S2 are noted with no gallop. I'm gonna go ahead and listen with the bell of my stethoscope. Again at the aortic, the pulmonic, the herbs point, the tricuspid, and the mitral. No murmurs or extra heart sounds noted. Okay, I'm gonna go ahead and move on to your abdomen if you wouldn't mind laying down for me, please. Thank you so much. I'm gonna go ahead and inspect. Our abdomen has a flat contour. Abdomen is symmetric with no visible masses or lesions. The umbilicus is midline, inverted with no discoloration noted. I'm gonna go ahead and take a listen to those bowel sounds. I'm gonna listen with the diaphragm on my stethoscope in 4 different quadrants. I'm gonna go ahead and start in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Bowel sounds are normoactive, present in all 4 quadrants. I'm gonna go ahead and palpate. I'm gonna start pushing on your stomach with just a light push, and you let me know if you feel any tenderness at all, okay? Any
Nope.
pain? Okay, good. I'm gonna go a little bit deeper this time. Any pain or tenderness?
Nope.
Okay, abdomen is soft and non-tender. All right, thank you. You can go ahead and sit back up on the edge of the bed. Okay, I'm gonna assess those upper extremities, your arms. So the skin, again, is consistent with ethnicity, with a few freckles noted, even distribution of hair. I'm gonna go ahead and palpate. Skin is warm and dry to the touch. I'm gonna go ahead and feel these joints. Any pain or tenderness noted?
Nope.
Okay, joints are symmetrical with no obvious swelling or pain noted. I'm gonna go ahead and check your radial pulse. Radial pulse is equal bilateral +2. Go ahead and check out these fingers. Nail beds are pink with no cyanosis noted. Go ahead and push on your fingernails to check your capillary refill. Good, capillary refill is normal within 1 to 2 seconds. While I'm here, I'm just gonna take a quick look at those nails. There is no clubbing present. I'm gonna go ahead and check your strength now. If you could squeeze my fingers. Good, ooh, strong. Push down, good, and then push up. Good, patient strength is equal bilateral. A little stronger than you think,
Yes.
sorry. Okay, I'm gonna go ahead and inspect your lower extremities now. So the skin is again consistent with ethnicity, no signs of lesions or masses or redness noted. I'm gonna go ahead and palpate. Skin is warm and dry to the touch. I'm gonna touch those joints again. Any pain with those joints?
Nope.
Okay, joints are equal, symmetric, with no obvious swelling or pain noted. I'm gonna go ahead and press on your shins. I'm gonna check for your pretibial edema. Good, no pitting is observed. I'm gonna go ahead and check your pulses now. Your posterior tibial pulse is equal bilateral +2. Your dorsalis pubis pulse is equal bilateral +2. And go ahead and check out those toenails. Again, they look pink with no cyanosis noted. I'm gonna go ahead and check that capillary refill. Good, capillary refill is normal within 1 to 2 seconds. I'm gonna go ahead and check your strength now. So if you can push your toes to your nose, good job. And now push down against the gas pedal, good. Can you press out against my arms and then back against the bed? Good job. Strength is equal bilateral. Well, thank you so much for completing this head to toe with me today.